Hi, I'm Joseph Gauta. I'm a board-certified urogynecologist in Naples, Florida with the Florida Bladder Institute. I want to talk to you today about some office procedures that you can perform and also improve your patient satisfaction by doing in the office. Almost everything I do in the office procedure-wise includes the GStirrup, which stabilizes the patient's legs beautifully. It makes the patient more comfortable and it makes me more comfortable because myself or my staff do not have to hold the patient's legs or keep reassuring the patient that their heels or feet will not fall out of the standard stirrups. Today, let's talk a little bit about fractionated CO2 laser therapy in the office. There are many different types of energy devices on the market. We happen to use the Core 2 Intima device, which has an internal and external handpiece, and it can also be used on the face for CO2 fractionated laser therapy for surface wrinkles and discolorations. In the vagina, typically what we do is we use a compounded anesthetic agent in a gel format or a cream format that includes 20% benzocaine cream and sometimes lidocaine also as a faster acting agent. We kind of slather that onto the labia and clitoral area and into the opening of the introitus. It's not necessary in the vagina because the vaginal discomfort that comes from a fractionated CO2 laser is minimal on the inside, but it can be significant on the outside, on the squamous tissue of the skin and the face too, the labia down below and the face, nose, and forehead up above. So even on the face, we use this same 20% benzocaine cream and let it sit in place for about 20 minutes before we get started. Before we get started though, we always wipe off the cream and dry off the face and the labia. And using in the vaginal and vulvar portion of the procedures, we use, of course, a disposable internal handpiece and an external handpiece. It takes approximately 15 minutes to do the vagina and vulva, maybe 20, depending on how much tissue is present and how aggressive the patient would like you to be. We usually take about 20 to 30 minutes to do an entire face and neck for patients. Of course, these are all cash-based procedures, which is a great boon to your own practice, and the patients tolerate it remarkably well in the office. Without the G-stirrups, it would be difficult. Doing a 20 or 30-minute procedure in the vagina and the vulva would be very difficult using traditional metal heel holding stirrups. So these G-stirrups have been a big boon for us and have allowed us to do all of these more complex procedures in the office and not have to worry about bringing the patients to a surgery center or to an office surgery suite.